to present community resilience, response to recovery. Welcome, Donna and Dan.
Well, welcome everybody to our presentation. We'll go ahead and jump right into the first slide on global warming. It is one of the biggest symptoms and larger problems of human-caused climate change. How does this impact us as Parks and Recreation community service professionals? More droughts, meaning more increased frequency of storms, more intensity of storms, wildfires. Those of you on the West Coast are very familiar with this. Longer wildfire seasons, not limited to hurricanes and wildfires as well. Again, one of the symptoms of wildfires is also potential for high flooding. So we are having to deal with a situation in which our environments are changing and in which we need to be more prepared, not just for any one event, but multiple events at any given time. GP Red Initiative ORR Operation Recreation Response. We're going to give you a real brief history. Don will be taking over here. The goals, concepts, stumbling blocks, current status, and some new challenges. So Donna, back to you.
Thanks, Dan. Yes, so first of all, this session is very Parks and Rec oriented, but for those of you who are not in Parks and Rec, how goes your Parks and Rec department goes your community? We provide such vital services and facilities indoors and outdoors that we need to be as prepared. And if your Parks and Rec is not prepared, your community is not prepared. Very brief history, if I can do this briefly. Operation Recreation Response was actually a response to a blurb in the NRPA magazine in the 1990s about join a group of professionals to respond to disasters. And I responded to that and nothing really came of it. And in 2005, prior to Katrina, I approached Kathy Spangler, then Director of Programs at NRPA, and said, whatever happened to that? And she said, we should talk. And after that, shortly after that, Katrina hit, and the need for preparation for all facilities came about through that. And this was sort of, it came through NRPA strategic plan and everything. And so the concepts basically are, the goals and concepts are first and foremost, and I go back to the fact that I'm a Girl Scout and I've been a Girl Scout my whole life, and you have to be prepared. And number one is preparation. After Katrina, a lot of the communities didn't even know what they had lost. So when there were grants available or help available, they weren't even sure what they had lost to be able to apply for those. That's the first one. The second part is response. And there's two parts to that response. One is who better than recreation people to go into shelters and make sure that the people that are long-term sheltered there have some activities and we can do something about the boredom and the longevity of the time in the shelters. The other response is a mutual aid piece, so that if my community is unharmed in an event and a community nearby has been devastated, including the fact that the staff has their own problems, their houses, their facilities, their rec facilities, their families, whatever, they should be able to deal with that. How about somebody else coming in and getting Saturday soccer off the ground? And then the last piece is the rebuild and rebuilding for resiliency. And of course, a part of that resiliency is to be better prepared in the first place. Some of the stumbling blocks that we have had is we worked with NRPA. We had some surveys. We did had a task force. We got some things accomplished there. There were funding issues that came up. And so we then, in 2014, I got an email from the then executive director of GP Red who said, you really need to talk to Teresa. And Teresa Pembroke had been asking, we should be doing something as Colorado was hit with the 2014 floods. And she and I connected, and now this is a GP Red initiative. We partnered at that point with Save the Children and also with Foundation for Sustainable Parks and Recreation. We made some great inroads with Save the Children. We did some training for Parks and Rec people to be able to go into shelters. We worked with them to create a prep rally guide for Parks and Rec for disasters and a manual for children, how to deal with children in an event. So we're hoping to keep moving forward. We do have a coalition, and if you are interested in helping us with our OR coalition, you can just email me at the end. Of course, we're now facing new challenges, and the new challenges are related to COVID. So through NRPA, we did a survey, a nationwide survey in 2007 and again in 2009 to see how prepared agencies were and whether this concept of having mutual aid, having Parks and Rec respond, et cetera, would be doable to Parks and Rec people. And then in 2019, GP did a red line survey to address some of the same questions to see if progress had been made. I'm going to run through this relatively quickly, but number one, and one of the couple of things that have come up is that Parks and Recreation agencies play a significant role in community disaster. And when the majority who responded had been affected, managing shelters and assessing damage seems to be the number one role that they have. But here's the key piece, the last one on there. Majority had not received training or prep for an emergency in the past 3 years, which means that if you have an emergency management plan, but it's sitting on the shelf and you haven't practiced it and you haven't trained, well, you kind of don't have one. I love this quote. I know we should be prepared. I just don't know what that means. We did have 46% say they were on the emergency management team, which is really key component to this. But this 25% who didn't know kind of baffles me a little bit. If you don't know you're on the emergency management team, you're probably not. So that would probably be a 46% no. And this is key. A lot of Parks and Rec agencies are utilizing their facilities as shelters during a disaster. Does your Park and Rec have a specific emergency management plan for your department? 57 yes, but again, we had 25% who said no. 21 said no, and 25% they said they didn't know, which I kind of think means you probably don't. This was the key one. If that their agencies had not received training for emergencies or disasters in the past 3 years, 64%, which again, if it's sitting there on the shelf, that's probably not a good thing, called cascading disasters. So it's extreme natural events that one leads to another, to another, to another, to another. And I'll use the example of the wildfires in the West. So wildfires in the West, horrible disaster. Well, now the rains come and really kind of help out taking care of the wildfire, but that can lead to flooding and or landslides. So there's your cascading. And concurrent natural disasters, which means two disasters happening at the exact same time, and each is serious as each other. It complicates your response, and it makes you have to approach it in a triage. What is the most important thing that we can do right now?
As many of you know, we're living in a new world where we're having to, from a Parks and Recreation community service standpoint, how are we addressing this within our organization? COVID has had us made to think outside the box, whether it's programming, whether using online services. We here at Clark County have been doing classes and field trips online to keep people engaged, keep them together. It's a challenge, and as all of you know, we're all in this together. We still need to be prepared for concurrent disasters because right now it's COVID. On the other hand, wildfires, rains, floods, landslides. You can throw in hurricanes. You can throw in earthquakes. You can throw in natural gas disasters, train derailment, but there's a lot of commonalities in how we prepare. So emergency response considerations, and most of these are consistent throughout any emergency response, any incident. Mass care, emergency assistance. Emergency assistance would be categories such as mass feeding, food distribution, pet policies, outreach. How do we reach out to our community members that may be isolated and get them in touch with the necessary services? And then throw in the added challenge of the pandemic and having to isolate. How are we going to address contact with people who need shelters when at the same time we're being directed by our local or state agencies? How are we going to address things? How are we going to maintain COVID protocol? And I've attached this, and I believe it's on the ORR website, is a list of references that I've compiled that will give you information on the National Incident Management Systems through FEMA. There's a lot of free training that you can get on it. And it also includes a lot of contacts, how to put together your nutrition plan, who your partners can be. a lot more than we can go over in 20 minutes, but you'll find in that attachment that I put out there, a lot of good, useful information, how you can look up, train your staff initially at no cost, and put together a list of how to address a lot of the other issues. Pandemics is a natural disaster. Again, Supreme Court ruled, yes, it is. Governors can make that declaration, and they have throughout our nation. Duration, like many of our other events, depending on the severity. We're going on month number 9 or number 8, depending on where you're at with COVID. But if you're dealing with a disaster such as a hurricane or an earthquake, you have infrastructure damage. You may be dealing with mass feeding and mass care for months, depending on infrastructure repairs. Far-reaching, it can be anything from a local jurisdiction to regional. For those like Don and myself that worked Hurricane Katrina, that involved a couple of states, quite a few states, and a lot of people. Complications, again, what are we dealing with here? Are we dealing not only with infrastructure, are we dealing with utilities, water services, a whole host of other things that we have to be addressed. And the big enchilada is preparedness. How do we prepare? One of the things you'll find in one of the references that I've included is the whole community principles. It cannot be government centric. We have to work with our local agencies, our local partners, because we need to work with our food district, with our restaurant associations, with the Red Cross, with our YMCAs. We have to work together. We have to understand how our community works. All disasters begin and end at the local level, and is coordinated as a collaborative response, which involves the whole community. Again, we're also dealing with unique challenges with COVID this year. Mental health issues. There's a lot of issues related to depression out there and mental health, because in many instances, using seniors for an example, they rely on their senior centers to get out there and meet with their friends and interact, and they've been isolated. On this slide, you'll see some of the commonalities and a little bit of the differences between a natural disaster and the pandemic. Fear, distress, loss, grief, PTSD, stress, red tape, economic loss. With the pandemic, as I briefly stated, loss of connections, reporting mechanisms, compromise, jobs, too much isolation, length of the disaster, normal outlets not available. Again, as Parks, Recreation, Community Services, we need to get creative how we can still reach out to our residents and community to try to at least help alleviate that stress. So we're going through a lot of unique challenges right now. And again, response and resiliency, we have to regroup during and after the crisis. It's a test of not only us, but our communities and those we work with. But it's often the second and third events that are not planned for. And we need to do this when we do our pre-planning. We have to work assuming there's always going to be more than one event at any given time, because there truly is.
And just a quick add on that. I mean, I don't think many of us saw the pandemic coming. I don't think that was, or even at least to the extent that it is, were in any of our Parks and Rec emergency management plans.